She has patelloluxation in that knee, just the way Dr.
Can I record you?
Sure.
Oh,
Yeah.
okay.
I think that what Dr. Schatz told you is she thought she has patelloluxation now, or kneecap dislocation in that right knee. I agree with that diagnosis. She does.
Okay.
And so we need to get that patella stain in place so that it's not luxating anymore. That is something where what I would probably end up doing is kind of the standard things that we do for dogs with patelloluxation, meaning that what we tend to do is we deepen the groove where the patella rides or sits. So this groove where the patella is supposed to sit right here, that patella is popping out of place, going over to the inside.
Mm-hmm.
And so if we make that groove deeper, that patella is less likely to ride up and out of that groove.
Okay.
The other things I have to look at are whether or not this tissue over here, which is not very well represented by this model because it's broader, but is it too tight? And I often release that so it's not pulling things over to this side, and tighten up the one on the other side. And then I've got to look at this bump of bone here where the patella tendon inserts. And oftentimes it's a little bit displaced over to the inside, so it's pulling that patella to the inside. And so we will cut and shift that over. That is called a tibial tuberosity transposition. And so I will probably end up doing that for her as well. Now, in order to do that, or because I am in this area, I will remove the tibial plate and screws that is currently there. Okay.
So will you replace them with new bracket, metal, and all that?
Meaning, if we look at you're talking about this.
Yes.
Well, she doesn't need that anymore.
Oh, okay.
That was just there to hold the two pieces of bone together while the bone was healing.
Oh, okay.
So that can come out.
Okay.
Okay. We will be putting in 2 pins and a wire for what I am describing as doing.
Okay.
Now, I think some of the important things to understand are that we do have some potential complications, as we do with any or all surgeries. Anytime I have a patient with patelloluxation, the complications that I tell owners are possible are that the patella starts reluxating, which if it's going to happen, we're talking within the first 12 weeks. It's not like, hey, 3 years down the road. It's like, no, are we going to get this to stay in place or not? Okay. That is uncommon, but I warn all owners about it. There is the possibility that the bone does not heal after the surgery. That's really uncommon, and I think that is unlikely in her case. The other things that are typically uncommon, but I think she might be at a bit higher risk for, are number one, infection.
Yeah, that's what I wondered about.
Yeah, so the reasons I'd be a little suspicious that she might be at a higher risk of infection are the following. So number one, this is going to be her 3rd surgery on that knee. Number 2, she already has hardware in there. Okay. Number 3, she's going to have more, what do I refer to as surgical trauma, meaning I'm going to be creating a degree of trauma trying to get that plate and screws out of there. Okay. That creates more inflammation and a degree of tissue damage, which will heal, but I always worry about the more surgical trauma we have, potentially the slightly higher risk of infection. And then, of course, the last is this knee already, if I'm understanding correctly, has a history of infection.
Yeah.
Right. So we've got a history of infection with this knee. So it's not as if, hey, I get to go in and do a medial patelloluxation on a fresh knee, like I'm going in on a knee that's already had 2 surgeries and an infection.
Yeah.
Yeah. So we've got some risk there with infection. The other things that are rarely a big issue, again, I doubt is a big issue in her case, but we can't say for sure, are could she have a substantial amount of cartilage wear? in that knee that makes the knee overall unhealthy and uncomfortable, even if I get the patella to stay in place. Usually that's very unlikely, and I still think it's unlikely, but I mention it in part again because this is, again, she's had 2 surgeries and a knee infection already.
Yeah.
Like we're not dealing with a fresh knee. I'm dealing with a knee
That's been through trauma.
That's been through stuff already, like two surgeries and an infection. So it might not be the most. It's unlikely to be a pristine knee that I'm getting to work on, so to speak.
Okay.
I will also look inside the knee and see whether there's any meniscal tearing or anything like that that I can address at the same time. I suspect that the meniscus was released at one of the previous surgeries.
Okay.
Yeah. What questions do you have for me so far?
So you will do everything in one surgery at one time?
That's a fantastic question. So we do have 2 choices. We have a 1 or a 2-step process. So 1-step process means we go in, we take out that plate and screws and correct the patella luxation all in one go.
Okay.
A 2-step process would be saying, let's take the plate and screws out, let everything heal, make sure that there's no evidence of infection remaining, and then go back and do the MPL surgery. Okay. Now, my gut, well, either option's fine, and they both have pros and cons.
Okay.
So the advantage of the 1-step is you're getting everything done in one go.
Yeah.
Okay. The disadvantage is if there is any residual bacteria or infection present right now, then it means that we run a higher risk that we deal with infection following the surgery that I do. Okay?
Okay.
All right. With that said, I think that the 1-step is a reasonable option for her because at the current time, I'm not seeing dramatic or overt signs of infection at the moment.
Okay.
And in addition, I am not going to be putting an awful lot of hardware in her knee. I am going to be doing 2 pins and a wire. And so we could end up with infection, and I may need to come back and remove those pins and wire in the future. But it's not a huge surgery to remove the pins and wire in the future.
Okay.
It wouldn't necessarily, it's unlikely to be catastrophic if we have infection, okay? That doesn't mean it's good, it doesn't mean we want it. But the risk if you elect to move forward with the 1-step is largely risk of infection, okay?
Okay.
So the 2-step is a more cautious approach, but it does mean that you already know from the get-go that you're doing 2 surgeries.
Okay.
Right? Because you're doing 1 surgery to take out the plate and screws, and then you're doing another surgery to do the revision.
Do you think, I don't know how to put, do you think since she had the surgery since she had the infection in between the 2 surgeries, and the last surgery with the hardware didn't cause an infection, would that make you more likely just do it all in one?
Yeah, exactly. That's a relevant factor. In other words, if, for example, you said, hey, we did this most recent surgery, and then you had to do rounds of antibiotics because you felt there was infection and you had other issues, I'd be like, or she had like oozing or swelling or anything like that, drainage, I'd be like, I think that we probably need to do a 2-step. Okay. But today, and if I'm understanding you correctly, ever since this surgery, and actually she's had 3 surgeries done, right? Actually, she had the first surgery done for that knee, then they did the surgery to remove the implant, and then they did the surgery to put this in? Or did they take that out and put this in at the same time?
Yes.
Yeah.
She's had 3 surgeries total, 2 on the right and 1 on the left.
Yeah. So they basically did a 1-step revision for that, which means we could still have some bacteria on there, so we could end up with infection. But if I'm understanding you correctly, there's been no drainage or swelling after that where you thought, like, man, we've got an infection on our hands.
No.
So that, I think, puts us in a position where we can do the 1-step revision for this right knee.
Okay.
There's the risk of infection, but I don't think that risk is so high that we have to do the 2-step approach.
Okay.
Okay. I think we could do the one-step approach.
I would love to do that to get her.
Yep.
I mean, it sounds like you said, you don't. It sounds like it will be fine. I mean, we're going to take a chance on infection since she's had it before, but it's going to be less likely this time around.
The chances are better than not that if we do, even with a one-step approach, that I can get her patella to stay in place, I can get the bone that I will be cutting to heal, and that we will not have infection that necessitates pin and wire removal in the future. There is
Okay.
some chance that those things don't work out the way I just said and we have complications, but the chances are better than not. They're more in our favor than they are against us.
And then, what is your opinion on the left knee?
Yeah.
Dr. Susan said something about she's going to need more surgery on the left leg.
Well, the left knee is unstable.
Okay.
So, in an ideal world, I would revise the left knee to a TPLO.
Okay.
And I would stabilize that knee. I would make her function better than it currently is.
Because since she's going to be putting more stress.
No,
that
we
won't.
don't even have to talk about that. It's just
Oh.
that left knee right now is unstable.
Okay.
It isn't. The ACL is ruptured, as you know. The fishing line was placed. That fishing line is either stretched out or broken, and her knee is unstable again.
Okay.
So, if she's able to cope with that instability and meet your and her goals for a good quality of life, then you are not obligated to revise that left knee. But if you asked me from a medical standpoint, is revision of her left knee going to improve the stability and improve her function? The odds are yes.
Yeah.
Yeah.
Yeah, you can tell. It'd be nice to. She's got, like I said, she's going through her puppy life, going through all of this, and be nice to give her, let her be a dog, a lab, run and play.
Yeah.
You know.
Yeah.
Okay, so it sounds like we'll do the one step.
So that's fine with me. Yep.
Okay.
So what we would need in order to get prepped for that are the following things need to happen. So we would basically, in no particular order, we've got to give you an estimate for
Yes.
doing that. I will prep you that our costs are a bit higher because it's a revision, which means we are going to have to treat things like there is potentially infection. So for example here, we do not take any patients with potential infections into our primary operating room.
Okay.
Like, we treat that operating room pristinely. So we will be taking her into the operating room where the point I'm bringing up is we have certain protocols for our other operating room where we have to use more disposables. We discarded those disposables, and we're treating things very, very rigorously in terms of keeping things clean, biosecurity, trying to prevent her from having infection, trying to prevent other patients from getting infection. And so the disposable aspect represents a cost to us that effectively is passed on to you. So that's, I want you to understand, like if you see like, hey, we've got a biosecurity fee on there, that's associated with doing that
Okay.
stuff. Exactly.
That makes sense.
Yeah. So basically, for example, things that we use for her that for some other surgeries for patients who are pristine and naive, we may reuse. For her, we may discard.
Okay.
Yeah.
And what is the next? Would we put her like on antibiotics before the surgery?
No, I would
Okay.
not. Yeah, great question. No, but I would strongly consider that we do some antibiotics going home after surgery.
Okay.
Yeah, I think that's reasonable. One of the other questions too would be whether or not you want us to take a culture at the time that we do surgery. The purpose of that culture would be, let's say for example, we do surgery and we do take a culture and then she manifests with infection 5 days later. The culture may help tell us like this is what organism is likely present. and some antibiotics that might be most likely to be effective. Okay. The downsides of cultures are just that cultures are remarkably pricey.
Yeah.
Cultures are like $300 a pop.
Yeah.
So
we've gone through that, so
yeah,
we
they're
definitely know.
They're
Yeah.
not cheap. Cultures are not cheap. Nothing's cheap anymore.
Right.
Um,
But sometimes it makes sense if she's was prone to infection before, knowing.
I mean, in her case, whenever I have a scenario like this, I think that it makes an awful lot of sense to get that culture. At the same time, I don't feel strongly like what we're going to do is present you with an estimate, and it's going to have, for example, culture on there as a plus or minus,
Yeah.
and we're going to let with the associated price, and then you let us know whether or not you want us to do it.
Okay.
So we need to get an estimate to you with that pricing. We then get a surgery date set, and then whenever the surgery date is set, we need to make sure we have some pre-anesthetic blood work done.
Okay.
And so I'm going to check right now and see whether or not we have any blood work by chance already for her. Let's just have a peek. See if we do. Because like Dr. Schatz and team may have already done some blood work.
Yeah, I can't remember.
This looks like December.
Okay.
So we should get blood
Blood
done
work.
too. This one is. Yeah. Yeah. So we should repeat blood work. So once we
Okay.
figure out when we're doing surgery, if you know we're going to do it soon, like we're going to do it in the next month, we could just get the blood work done today.
Okay.
That's up to you.
Okay.
If you're like, no, we're going to delay surgery and you want to get blood work done somewhere else, I say just make sure we've got the blood work about 5 days in advance.
Okay.
Or sooner than that. But in other words,
Okay.
give us a few days heads up on the blood work.
Okay.
Okay.
Sounds good.
What questions, if any, can I answer for you? Or
Oh,
is
I
a video for the rescue team?
Yeah,
on board, or?
yes, if that's
Yeah,
okay.
it's
I
fine.
put it on YouTube and share it with the board members, and then we've got a small, we're called Furry Kids Refuge, and so we've got a furry crew page that's for our people that volunteer a lot, and there's like over 100 people on there,
Yeah.
and they all like to see what we're raising money for.
Yeah, makes
So
sense.
yeah, that really helps. And plus, I can't explain all this. Like I told you, I kept calling it Band-Aid, and it's like I didn't.
No, you did. You did a
Yeah.
good job.